Good afternoon. So my name is Ulike Boehmer, and I talk to you about sexual and gender minority population cancer research, no longer fundable by NIH. And why focus on sexual and gender minorities? These are the people we used to call lesbian, gay, bisexual, transgender, and then added on to many things. So now the term is sexual and gender minorities. They're an underserved population, they're a disparity population, have multiple adversities, but we don't really know a lot about their cancer. We know they have higher cancer risk factors, risk behaviors, and therefore we think the risk behaviors is a proxy for a greater cancer prevalence. There's no easy way to determine this because cancer registries do not collect sexual orientation and gender identity data. So this is supposed to be about equity, but there's no conclusive answer if there is a higher cancer incidence and potentially a shorter survival. However, making use of population-based data that we do have, we were able to show a greater frequency of cancer diagnoses among sexual and gender minorities, and also that they're diagnosed with cancer at an earlier age. Much work has focused on the psychosocial aspects of sexual and gender minorities with cancer during their cancer survivorship. And so we see there are multiple inequities. It's the lifetime discrimination they experience. They bring it to their cancer experience, to their cancer treatment, and it burdens the cancer survivor. And they have worse health outcomes, mental health outcomes. They use more to cope, use more cancer support groups and counseling related to cancer. And sexual minority women with cancer are a particular troublesome group in the sense they have worse access to health. So that means there is a real danger they receive less follow-up care, which might have implications for their detecting recurrences early and improving their healthy survivorship. And there are greater rates of depression among sexual minority cancer survivors compared to their heterosexual cisgender counterparts. Now, with respect to health behaviors, we know in the general population, there are these differences. Troublesome is really that we also found differences after cancer. So cancer is sometimes thought of as this teachable moment. People clean up their act and get better cancer behaviors, health risk behaviors, better healthy lifestyle. So far we know sexual and gender minority survivors have still worse health behaviors as heterosexual. In the absence of cohort studies where we can really look at the change from before cancer to after cancer, we did a comparison of sexual and gender minority survivors to sexual and gender minorities without cancer, and we saw no indication that there is a positive change in lifestyles, health behaviors. Some had even worse health behaviors than their comparison group without cancer, or the health behavior stayed the same. And so, of course, that raises again questions about recurrence and survival. So given the current state, we need to continue this work, and one way to do it is systematic data collection of sexual orientation and gender identity, so we can also answer clinical questions if there are inequities in clinical indicators such as maybe late diagnoses, differences in treatment, and differences in survival. Thank you.